So this is an example that I wanted to share today, Beth, that really points to a real live analysis. This is one county out of New York using real data, a real network, and being very generous, actually. At the time we did this, we looked at provider attestation over a 1-year period. And if you think about it, that's pretty generous, considering that the No Surprises Act finally settled on every 90 days requiring that attestation. And what we found is, looking at this county and this real network, is when you removed providers from the provider directory who had not provided attestation in the time frame that we spec'd out, we saw some pretty dramatic impact, including the drive time. We saw an 8-fold increase in the distance and the time that members would have to drive to see a provider. We saw a 90% decrease in primary care availability, the access points actually shrinking 9 out of 10. And then we saw at the same time a 91% decrease in the provider market share offered by this particular carrier in this particular network. So if you go back and you look at those results and you think about the questions that they raise, they're pretty serious. You think about the increased driving distance. Will your members actually drive 8 times farther to see a provider that is in your network and in your provider directory? If 90% of the access points simply don't appear in your provider directory, what happens to wait times? And what's the impact on the 10% of the providers who are in your provider directory? How will they react? What's the opportunity there for provider abrasion? And then in the far right, thinking about that 91% decrease in primary care market share, what happens to the competitive advantage of your network? And if you think about it from the perspective of a member who has selected your plan based on their doctor being in your network, all of a sudden they go back to actually utilize services and the provider has been removed from your directory. Or someone who's trying to make a decision about which plan to select and having the misinterpretation that your network has shrunk, when really what you're doing is you're not able to reflect your providers because of this lack of attestation in that 90-day period. So just to put a very real world example out there, this is the kind of result that we may start to see as we move into January of 2022.